So, and so under shock, there's the lethal triad that kills the patient. So there's metabolic acidosis, hypothermia, and then coagulopathy. Then another thing we are worried about under the first hit is the inflammatory insult. So, for instance, if a patient gets, we say, like long bone fractures, the body releases mediators and cytokines that elicit systemic defense mechanisms, which could lead to neutrophils adhering to endothelium, damage to the endothelium of blood vessels. From this adherence, then loss of the barrier functions of organs like lungs and other organs, then it could result into things like acute respiratory distress syndrome and multiple organ failure from the inflammatory response. So next slide, please. So for the second hit, it's the body's immunologic response to ongoing either physiological disturbances or subsequent interventions. So for instance, compartment syndrome, it's basically an exaggerated response to either even the surgery the patient gets as treatment. Yeah. So the next slide, please. Okay, so for the principles of management for polytrauma patients, they're divided into different phases. So, they're like different surveys done at different points. So the initial one is a primary survey. Those who've done ATLS know this. So ATLS is Advanced Trauma Life Support. It's taught in surgery in, I think, for then 16 most schools. So, and yeah, you can also take it as a separate course. So for the primary survey, it uses the ABCDE algorithm, which is, it helps prioritize treating the most rapidly life-threatening injuries first. So A stands for airway, which goes along with the C-spine stabilization. So here you might need to like intubate a patient if they've lost consciousness. Then what else do you need to know? The stabilization of the cervical spine is key so that you avoid causing more damage while intervening on the patient. So the next one is B, which stands for breathing. So you identify and treat any chest injuries, be it tension pneumothorax, hemothorax, failed chest. So you can give oxygenation, yeah, such. So yeah, then the other letter is C, which stands for circulation. So here, you provide immediate hemodynamic support and hemostatic measures. So you could perform initial interventions like give IV fluids through the 2 large bore IV cannulas, and then also look for hemorrhage in case it's, because things like massive hemorrhage can cause shock, which is lethal to this patient. So you try identify it as early as possible and treat. Yeah, then for the next letter, D, it stands for disability. So here you try to identify like threatening uh, conditions like traumatic brain injury. So here's where you calculate the GCS of the patient, assess the pupillary light response and the motor and sensory functions, and then you start neuroprotective measures. Then for the E, or environmental control, you should completely undress the patient and then assess for any signs of occult injury, including the axillars, the groins, and the back. And then also be cautious to manage hypothermia in some of these patients that are in shock. Yeah, so now the next thing, and the primary survey are diagnostics additions. So there are imaging you should do, and it was the first criteria. So okay, I don't remember what the acronym first stands for, but the imagings that should be included there include chest X-ray, pelvic X-ray, and C-spine X-ray. Okay, then once you've stabilized the patient there, I think now you can move to do the secondary survey. So here is where you collect, you do a kidogo thorough history and now a physical exam. So for the history under secondary, they use the acronym AMPLE history. I'm sure you've seen it in casualty admission letters of patients. Kuna kwanga na like acronym imeandikwa ample history. So A stands for allergies, M, medications the patient is on, P, the past medical history or pregnancy status of the patient, then L is the last meal the patient had, and E are events and environment related to the injury. So this is obtained to estimate the patient's physiological reserves, like their health before the accident and such. So after the ample history, now you can even take a more systemic head to toe physical examination. Yeah, then you document your findings. Then if the patient is okay, is stable, you can, later you do the tertiary survey. So for the tertiary surveys are more detailed history. It's the normal history we take on a day-to-day basis, where you like sit down, ask like a reading from like history of presenting condition, then the family social history. You ask a reading and now you do the more systemic examinations. Yeah. So next slide. So in trauma, and especially orthopedic trauma, they use another criteria for timing and to approach patients who have fractures. So there's the concept of early total care, which is definitive stabilization of all long bone fractures during the early phase of treatment of this trauma patient. So and this is for stable patients. So it's within 24 to 48 hours. Yeah, what else is there to say about this? You just remember it's for stable patients. Then now for the damage control orthopedics, it's for unstable patients, and it includes stabilization of a patient in phases to avoid getting the second hit injury. So it includes surgery to control things like hemorrhage, so like ligation of arteries, such things, and also metabolic and respiratory stabilization, and then now the definitive management. So there's also something else when patients have fractures, the window of opportunity. So this is the definitive fixation of long bones. So performing the surgeries to correct their deformities, such as like open reduction, internal fixation. So it can be done between the 5th and the 10th day after trauma, when hyperinflation or hyperinflammation or the immunological status of the patient is now calmer. Yeah. So next slide. Yeah, so some of the complications we expect from this polytrauma patient include, the first one is shock because of the blood loss. Neurological injuries could also like give them neurogenic shock, such things. Then acute respiratory distress syndrome, I explained how that might come about. Then thromboembolic events, because they're bleeding a lot at this point, so fat embolisms, DICs, then crash syndromes, and also another long-term complication is multiple system organ failure as a result of things like sepsis. Yeah. So that's the end of my presentation. And for the summary, due to patients who have multiple injuries are very vulnerable to second hit phenomena. So we've said that the second hit phenomena are injuries caused due to either this physiological disturbance in their body when they're trying to heal, or any subsequent intervention done by doctors to like help them. And then the physiological response to major trauma should guide in designing a priority-based treatment plan for injury. So you've seen how we've gone through like the systematic management of these patients through the primary survey, secondary survey, yeah, that. Then polytrauma is a surgical systemic disease. Then also the primary objective of management of this patient is for their survival. So you ensure their survival first at whatever point. Then also early fixation of major fractures has proved to be an important tool to achieve survival of these patients. So that's the end of my presentation. Thank you so much for your time. I'm open to answering any of your questions.
All right. Thank you very much, Betty, for that concise presentation. Feel free to engage her with questions on the chat box. So at this point in time, we'll do the last bit of this session, a fun bit really, just to engage us a bit. And I'm going to invite the host to share their screen on Kahoot and engage all of us. So we're going to log into Kahoot, www.kahoot.it. Then we'll have a few questions just to tease our brains even as we come to the end. But feel free to add your questions as we wait.
Sorry, just give me a minute. But if there's any other questions, you can be answering that in the meantime.
All right. Since I'm not seeing any questions, maybe I can just say something I've taken from her presentation. What polytrauma is having two or more injuries in different areas, and either like cumulatively or one of them is life-threatening. such injuries qualify to be referred to as polytrauma. Yes, so thank you so much once again, Betty. We'll just give a minute to our host to share the screen. In the meantime, we can just log into www.kahoot.it and then we'll wait for the code.
I hope you can see the pin. It's the one on top, 704733.
Yes, we are able to see it. I encourage the participants. Let's join in. Okay, we're giving it a minute for you to join. So please just join in. Just a few simple guidelines. The faster you are, the what? The faster you are, the more points you get if your answer is correct. Yes, so I think we actually can start. And yay, I'm excited. Let's see who our winners for today will be. But let's enjoy the process. It's supposed to be as fun, as informative as it will be. Over to you, Samara.
So Olivia, normally like you moderate by reading the correct answer and just commenting on like positions.
All right. Okay. So definition of polytrauma. The blues have it. So it's two or more significant injuries in greater than two body regions, and 9 of us got it. Great. Amazing. We can see the scoreboard. Okay, so what is not a criteria for the Berlin definition of polytrauma? have hypotension, GCS score less than 8, age less than 50, acidosis, base excess, less than or equal to -6. And the answer is age less than 50 years. 8 of us got it correct. And everyone who attempted really got it correct. TH maintains the lead. Okay. What is the abbreviated injury severity score for a simple hemothorax? Minor, moderate, serious, severe. Right. The answer is serious, and higher demarcations have begun. 4 people got it correct. TH maintaining the lead. Okay, so in the trimodal pattern of trauma mortality, when do early trauma deaths typically occur? Amazing. The answer is within the first hour, and a majority of us got it. All right. Which is the manifestation of systemic inflammatory response syndrome? A heart rate of less than 60 beats per minute, core temperature greater than 38, rest rate less than 12 breaths per minute, leukocyte count between 5 and 10. Okay, so our answer is the core temperature greater than 38. IK has a streak with 5 correct answers in a row. Ish, that's lovely. What is the primary objective of managing polytrauma patients? Is it survival, early discharge from the hospital, complete recovery, minimizing surgical interventions? Yay. A majority of us getting it. Answer is patient survival. Okay, which category describes a patient who remains hemodynamically unstable despite initial resuscitation? Stable, unstable, borderline, in extremis. So the answer is unstable. What does the second hit phenomenon refer to in polytrauma management? So is it initial assessment errors, secondary infections, exaggerated responses due to surgery, delayed recovery from anesthesia? And so the answer is exaggerated response due to the surgery. What is the recommended timing for shaft fracture fixation in polytrauma patients? Is it within 12 hours, 48 hours, 36 hours, 24 hours? All right, so within 24 hours, Paul got it correct. Here we had IK still maintaining the lead. All right, which surgical priority is categorized as life-saving in polytrauma management? Repair of soft tissue injuries, control of massive hemorrhage, management of compartment syndrome, fixation of long bone fractures. Last question. All right, let's give it up for our winners. Third position, we have 1, 2, 3. Second position, we have TH. And for one, we already know it, IK. Congratulations, guys. Great job. And for our runners up, we can see JC and MN following behind. Great. I don't know if you guys are in a position to unmute and just say hi so that we are able to recognize you.
Good morning, guys.
Good morning. Kindly introduce yourself.
I'm 1, 2, 3, position 3. I'm Valence Gadara, year 5 from Kenya Methodist. Thank you.
Amazing. Congratulations and thank you for being part of this. The other two, THIK, are you able to say hi?
Hello, morning guys.
Good morning.
Yes, my name is Isaac Yegon, 5th year medical student at Kenya Methodist University. IK.
Congratulations and thank you for being part of this. And then I can see TH has texted and Egwa Mwangi. Yes, congratulations. Thank you for participating, even as you say thank you for the session. All right. So thank you guys for joining us. Thank you, our presenter Betty, for preparing the presentation and actually delivering it. Thank you for XYZ Med as a whole for organizing this and ensuring we have a forum actually interact. Yes, so are there any questions before we formally bring this meeting to an end? I'll give it a 30-second breather before we finally wrap the meeting up. All right, there seems to be none. But all in all, thank you everyone for joining. See you next week, same time, different topic. And yes, feel free to engage us at XYZDZDmed in the different social media platforms. Yes, for more things. So thank you for joining. Have a lovely weekend. Goodbye.